Patients who find themselves homebound while they cope with a chronic illness or recover from a hospital stay often feel anxious and overwhelmed, wondering where to turn to as they begin their recovery at their home. We at Phoenix Home Care can transform this situation into an empowering experience for patients and assist them in becoming self-reliant once again. Phoenix's multidisciplinary team of caregivers creates a customized treatment plan that aids in our patients' ability to build confidence while working toward positive outcomes. Registered nurses, physical therapists, speech therapists, occupational therapists, certified nursing assistants, and medical social workers treat our patients and educate their families, ensuring that our patients receive a safe and speedy recovery.
You know, Audrey, you remember when I first came home from the hospital after the hip replacement surgery, I didn't even know if I could get to the bathroom on my own.
Oh, I worried about that too.
My biggest concern was that being at home, how was I going to get around? How was I going to maneuver? And it was got to be intimidating. It was a big concern. And then the fact that it'd be a burden to you. And I didn't want that at all.
No, never a burden.
Well, that was my concern, it really was.
Never a burden, don't worry.
I was impressed by Phoenix Home Care because it offers a level of accessibility that is hard to match in the industry. Phoenix intake nurses work from 8 a.m. till 6:30 p.m. Monday through Friday and 8 a.m. to 4 p.m. on Saturdays and Sundays, providing patients with the highest quality care and attention. They also carry CoaguCheck machines to measure proteins using a nearly painless fingertip stick.
Each Phoenix nurse carries an average caseload of only 16 patients, about half the industry average. Each nurse averages only 5 nursing visits a day. This gives the Phoenix nursing staff more time to spend with each individual patient. More than 50 physical therapists who work directly for Phoenix Home Care offer in-home care 7 days a week, which means that patients receive more continuous therapy, improving the odds they will achieve a full recovery. Phoenix Home Care, which is accredited by the Joint Commission, opens all cases within 24 hours of discharge, 7 days a week, and covers 9 counties around the Chicago metropolitan area, including Cook, DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will counties.
I feel confident that patients who select Phoenix Home Care for their home recovery needs will achieve positive outcomes and avoid being readmitted to the hospital. That makes me feel good about the job I've done in helping them arrange for care during their recovery, and about the fact that neither they nor the hospital will incur additional expenses for readmission charges not covered by Medicare.
Well, once I was discharged, the Phoenix Home Care caregiver guided me through a comprehensive assessment that enabled me to set my own goals so I could achieve my strength and mobility again.
They were very helpful.
The physical therapist allowed me to adapt the house so I was able to move around easier, and I had a little bit more strength, and before you know it, I was able to help Audrey out a little bit.
And you know how I love to garden.
Oh, I do.
Now I have somebody to help me again.
I was able to get my strength back, and things are starting to get back to normal. I was very pleased with that.
Even though I've been coping with diabetes for 10 years, my health continued to fail because I never learned how to take care of myself properly. After my hospital stay, the Phoenix caregivers came to my home and made me feel just right in my everyday environment, helping me to achieve my goals. But the work they did with me also helped me to develop a greater confidence in my own ability to take care of myself. And overall, I just feel better about having this ability to manage and live with this disease.
Well, Ben has never really been successful at adapting his lifestyle to help him deal with the risks and complications involved with diabetes. So after working together with Ben for a couple of weeks and finding out what was holding him up, we put a plan into place so that he now can better manage the risks and complications involved with diabetes.
Phoenix Home Care helped me manage my diabetes. But more importantly, for the first time, I feel as though I have some control over my condition, rather than like feeling my condition is controlling me.
Phoenix Home Care consistently outperforms its national and local competitors on many outcome-based quality indicators.
Hello, my name is Pete Miska. As President and CEO of Phoenix Home Care, I make it my daily mission to provide quality care to our patients and help them return back to their normal lives. If you visit www.medicare.gov, you can view our home health compare scores, which demonstrates our commitment to quality.